All right, we're back. So, sensory nerves. So, just something to keep in mind, and we've already more or less touched upon this. You can feel your left arm, obviously. Can you, for the most part, feel the really subtle changes of your heart rhythm? Can you feel the digestion of the snack you just ate? Well, unless there's a problem, you shouldn't, right? When we're dealing with sensation, somatic's going to be very different from autonomic. Somatic is going to be our skeletal muscles and the sensation of our environment. Autonomic function will deal with those automatic functions that happen in our body all the time, the viscera, the organs, okay? So, unless you're like really running really hard, you won't feel that heart rhythm change, okay? Same thing with all those other automatic functions in our organs. Excuse me. So skeletal muscles contract by what's called a motor unit, excuse me. A nerve will go to the muscle cells, and one nerve will provide the nerve supply for a grouping of muscle cells. So your biceps brachii, okay, which I think we're mostly familiar with. That's always the muscle that if you tell little kids, show me your muscles, they, fluff up that biceps brachii, is going to have one nerve supplying it. Your triceps have one nerve supplying it. And if you can imagine, that nerve goes in, and then the nerve divides down and down and down and down to smaller subdivisions. And it provides a whole bunch of little nerves to a whole bunch of muscle cells, okay? Now, acetylcholine is going to be the neurotransmitter that's going to make muscles, skeletal muscles work, okay? We've got voluntary, and then we've got involuntary, which is going to be reflex. Now, reflexes happen as protection for our muscles so they don't get too overstretched. When they do that knee tap reflex and your quadriceps contract, the reason that happens is that your muscle feels that it's being overstretched, and in order to protect it from being stretched to the point where it would pull off the bone, it'll contract. It's a reflex that prevents muscles from being overstretched, okay? So reflexes. We've got what are called spinal reflexes. If you can imagine in your mind the spinal cord, and we're looking down inside the spinal cord, we've got that gray matter on the inside that's the shape of the butterfly. We've got sensation coming into the back, motor going out the front. We've got that interneuron in that gray matter in the spinal cord, okay? This is where spinal reflexes happen. They happen at the cord because they're in response to a damaging stimulus, so it happens very quickly. Rather than sensation going in up to the brain, being processed and sending out a response, happens right in the cord at that interneuron, okay? So we've got the stretch reflex. I'm jumping at the bottom because that's what I just talked to you about. That knee-jerk reflex, which is a quick stretch that causes that muscle to contract, okay? The quads will contract, and then your hamstrings will actually turn off. And if you think about that, that makes sense. You can't contract your quads and your hamstrings at the same time. It makes no sense. You wouldn't move anywhere, okay? Unless you're using them to stabilize a joint, that's a whole different story. But if your quadriceps are trying to straighten your leg and your hamstrings are contracting, well, your leg's not going to go anywhere, okay? So the antagonistic or the opposite muscle, okay, the antagonist in a play is somebody who fights against the good guy. So an antagonist is going to be opposite, okay? Opposite the good guy. The opposite muscle will be turned off. That's the whole premise behind a stretch reflex. It's protective. Okay, it contracts that muscle, turns the opposite muscle off. Now there's other reflexes. There's something called a flexor extensor reflex. Let me bring you out for a second. Flexor extensor reflex. So suppose over here I have a hot stove. I've burned myself. My reflex is to pull away. And to pull away from that, we move into flexion. Well, if you pull away hard enough, you can knock yourself over, can't you? So this reflex of flexing away from a damaging stimulus is countered by an extension. So I put my hand out in hopes that I'll catch myself. It's called a crossed reflex. across flexor extensor reflex in response to a damaging stimulus, okay? That's in the spinal cord as well. And that's a very deep inherent reflex that protects us, pulls us away, and protects us from falling, okay? Now, the other thing about this note, I almost moved on, is it does send signals to the brain, excuse me. It sends signals to the brain that says this has happened, there's painful stimulus, but this reflex happens at the cord, okay? So the sensation will go to the brain so we know what's going on, but this reflex happens at the cord, okay? Little picture of that patellar reflex, cute little girl, okay? Let's think, what could change a spinal reflex? Well, what could happen to the cord? What could happen around the cord? You could get a herniation. You could get a tumor, okay? You could get trauma. So spinal reflexes are a great, simple, cheap screening test that we could use to see if there's been damage to the cord. So it's one of the first things that we'll do when somebody comes in who's been in a car accident, okay? One of the first things, if they're able to do so. Check the reflexes, check sensation on their skin, and you would check their motor strength as well. All of those things can be damaged with trauma to the spinal cord. Autonomic nervous system, okay? So autonomic nervous system is going to consist, this is a series of nerves that'll happen and begin in the central nervous system and go out to the periphery of the body. So they're part of the central as well as the peripheral nervous system. And they include sympathetic and parasympathetic. So sympathetic, guys, is fight or flight. That means the bear comes into the room and all of us go, holy crow, we need to get out of here because there's a bear in this room. Fight or flight. And the premise behind that title is it makes you decide whether you're going to take a hike and run away or fight that bear. Now, parasympathetic is relaxed. Parasympathetic is calm. Parasympathetic is when we eat, when we go to the bathroom, actually, diuresis and defecation. We'll get into this, okay? Just, I'll give you all these notes. I'm just giving you an introduction. And what happens in our autonomic nervous system is they balance each other for the most part. You know, obviously, if the bear comes into the room, we're in fight or flight. But you can't be at that level of stimulation for the rest of your life. It would overstimulate the body too much in many ways, okay? And we can't be at an extreme level of parasympathetic either. You've got to have some get up and go so you can get up and get things done, okay? So autonomic. Similarities of parasympathetic and sympathetic, they're autonomic, they're automatic. They both have two nerves with a ganglia in between, okay? Excuse me. So the ganglia, are a collection of cell bodies. So the areas that we're going to see these ganglia, guys, are in the dorsal root ganglia, which we saw in the sensory component of the nervous system. It's right near the spinal cord, okay? It's an enlargement on that dorsal root of nerves that go and bring sensation into the cord, okay? Now, parasympathetic and sympathetic also have ganglia. They're a collection of cell bodies. They look like a little sac, okay? These ganglia are going to connect the two nerves that are going to be both in parasympathetic and sympathetic. So every one of the nerves that carry information for parasympathetic and sympathetic nervous system are going to have two nerves, okay? Here's where it gets confusing. Okay. If we have a ganglia and we have two nerves, I'm going to try to make this as simple as possible, okay? So if I'm drawing one of those collections of nerves from either sympathetic or parasympathetic, we'll have one nerve, we'll have a ganglia, which is a collection of cell bodies, and what I mean by nerve really is an axon, okay? Axon carrying information. I say nerve to sort of simplify it a little bit, but realize it's a collection of axons like we looked at the beginning of this lecture, okay? And those collections of axons form nerves, okay? And then we've got a collection of cell bodies, and this is going to be a ganglia. And then we have a second nerve that'll carry information into the brain. Okay. So what we're doing with these two nerves is we're carrying information from the body to the brain, to the spinal cord, I should say, and then from the spinal cord out to the body. Okay? So we've got what's called a preganglionic neuron. Don't let it blow your brain. It's exactly what it says. So the first nerve before the ganglia is called the preganglionic neuron. The second one is called the postganglionic neuron. Okay. Preganglionic neuron, postganglionic neuron. Okay? Okay? That's what we'll start with for now. There's a little bit more to it, but that's what we'll start with for now. So both have two nerves with a ganglia in between. I'm going to zoom you back in. Okay. Excuse me. So differences of parasympathetic versus sympathetic. So sympathetic is fight or flight. Now, the nerves for sympathetic come out from the thoracic and the top of the lumbar spine. The nerves for sympathetic come out of the thoracic and the top of the lumbar spine. So therefore, they are known as being thoracolumbar because they come out of the thoracic and the lumbar. There are sympathetic nerves that go to all of the organs in the body. Okay? There are exceptions with parasympathetic. Sympathetic has a lot less nerves. Okay? Now, the neurotransmitter for the sympathetic nervous system that's going to stimulate the organs is norepinephrine, as opposed to parasympathetic, the neurotransmitter is going to be acetylcholine. Okay, so they use different end neurotransmitters. Okay. So, and parasympathetic is going to be relaxed. Now, parasympathetic is going to come out of the cranium and the sacrum. Sacral areas. So all the nerves for parasympathetic are called craniosacral. Okay, craniosacral. So there's my sympathetic guy running up there and my little sleepy guy at the bottom. I thought he was cute. Okay, so differences of parasympathetic and sympathetic. Now there's a whole chapter I just want to know on sympathetic and parasympathetic. I'm just trying to just sort of lay the foundation for it. Okay. A fight for homeostasis, parasympathetic versus sympathetic. They oppose and balance each other, as I mentioned earlier. You can't totally be in sympathetic all the time or parasympathetic all the time. It's got to balance. Got to balance. Unless, of course, you're in a fight. Then you want sympathetic to kick in. You release adrenaline and noradrenaline. It gives you that extra strength that increases heart rate, increases blood supply to the muscles. Okay? You want to be in parasympathetic when you're eating. Parasympathetic is going to send more blood to the GI tract and absorb all those nice, good nutrients. Okay? So there are times where one's going to be better than the other, but for the most part, they got to balance each other out. Innervation of skeletal muscle, we talked about this earlier. We've got a nerve to a muscle cell. We've talked about pre and post synaptic cleft already. Please, if you don't remember that, go back and review it. We talked about it, I believe, in chapter 3. Okay. Acetylcholine is going to be the neurotransmitter that will be used for skeletal muscle. Okay. Now, acetylcholine esterase is going to be stored in the basal lamina of muscle. Just remember, it's stored in skeletal muscle. And acetylcholine esterase is going to break down that acetylcholine so we don't keep acetylcholine stimulating the muscle all the time. Okay. It's important to break it down. If you keep stimulating that muscle, you would have, basically a spasm of that muscle. Okay, acetylcholine esterase is going to break that down. Innervation of viscera. So once again, viscera means organs. And the innervation to the viscera, actually, if you can imagine little pieces of this visceral muscle enveloped in a fishnet stocking. Okay, that fishnet stocking is a network of nerves that wraps around these little bundles of visceral muscle, and they are called varicosities. And they provide the innervation to this visceral muscle. So instead of breaking down into, branches like the skeletal muscle did, it forms a fishnet stocking around these organ muscles. It can release acetylcholine or norepinephrine depending on which part of the nervous system is stimulated at that point. Okay, so muscles only acetylcholine, viscera organs can be acetylcholine or norepinephrine. Okay, reflexes can be inborn or they can be learned. Okay, reflexes, driving is a reflex. Okay, we have a whole bunch of inborn reflexes. Children are born with inborn reflexes, the suckling reflex. If you ever hold an infant and stroke their face, they'll turn and try to suckle. Okay, that's a reflex. Their grasping reflex is another one. Okay, so we're born with them. But we've also got those reflexes that doctors can test as well. Okay. Spinal reflexes. We've already talked about this. I don't know why I repeated this. I apologize. You can just plain old cross it off. But spinal reflexes are going to be in the cord. Okay. The information comes in, is processed at the cord, and we have that response. Those the knee tap reflex as well as that flexor extensor reflex as well. Okay. Here's a picture of that stretch reflex. It's specifically called Patellar Reflex. They tap on the knee, the quads will contract, okay? And then the hamstrings will relax because they're sensing that tendon of the quad is being overstretched. And if we keep overstretching that, we can rip it right off the bone. So in response, we shorten that muscle and it helps to protect it. Okay. So flexor and crossed extensor reflex, we flex away and we extend out, okay, initiated by a painful stimulus causes automatic withdrawal by the threatened body part. Ipsilateral and polysynaptic, gosh, just cross that off. Okay, don't worry about it. I'll explain to you if you really want to know what it is. Okay, crossed extensor, when you put the hand out, that's going to be the opposite side. Okay, stimulated side is withdrawn. Superficial reflexes. There are superficial reflexes which should not be present unless there is damage to the brain and the cord. Now, one of the ones we talked about was Babinski, and I showed that to you in lab, okay? Plantar reflex is going to be the normal stimulation. You stroke the lateral aspect of the sole of the foot. I have a picture of this or a movie of this. You get downward flexion of the toes. This tests for function of what's called the cortical spinal tract, okay? What that means is the cortex talks to the spine and sends a message for movement, cortical spinal tract. It's one of those areas of white matter in the spinal cord. Because believe it or not, even though we've gone over a lot, we didn't go over all those tracks. There's tons of those tracks, okay? But in general, when we're talking about the white matter of the cord, it's going to send information to and from the body. In this case, it's sending it from the cortex to the spine, okay? Here is the plantar reflex.
We're now going to do the plantar reflex. I want you to hold still, try not to pull back, just relax as much as you can. We're going to go down the lateral aspect of the foot, across the ball of the foot. Very good. Going to do it over here on this side. Same thing, just relax. There you go. Very good.
Okay, so that's plantar reflex. That is normal. When you, sorry, I'm just trying to clear. There we go. When you do this test on someone, they should respond with a plantar reflex. That's what most of us should do. Now, if somebody has damage to their brain or their spinal cord, they will have what's called a Babinski's sign. It indicates that there is damage to that cortex, either the brain or the spinal cord, okay? So here's a baby that I think is just so cute. Stand it. So I should have prefaced that with it's normal in babies. Up to about a year, it's normal in babies. Can go a little bit beyond that, okay? Babinski's time is normal because their corticospinal tracts are not fully myelinated yet. Okay, that myelin is not covering the axons like it should. It can't get the signals down appropriately. So in infants, it is normal, those superficial reflexes. Babinski's sign, I'm sorry. Okay. Abdominal reflex, another superficial reflex that once again should be elicited in a normal patient, a patient that has not had damage to their brain or their spinal cord. Here is a video of this.
T5 to T12, we're going to stroke the skin towards the umbilicus and watch for a contraction of the muscles in the epigastric area. I'm going to stroke towards the umbilicus, watch it contract. That's from T5 to T7. T7 to T9, the upper right quadrant, scratch towards the umbilicus, watch it contract. Just lateral to the umbilicus is approximately T9 to T11. And then from the inguinal region up towards the umbilicus, watch it contract, is approximately T10 to T12.
Now he breaks it down to, he was saying, you know, T5 through T9, etc. Basically what it's going to test, it's going to test the thoracic spine to see if there's damage in the thoracic spine, okay? So superficial reflex, abdominal reflexes, because the nerves that go to those abdominal muscles are gonna come from the thoracic spine, okay? So abdominal reflex, quick screen. Now, if somebody had had damage to their brain or their spinal cord, they would not have that slight abdominal contraction. And that's it. Okay, I didn't realize we were at the end there, okay? Fantastic. Peripheral nervous system, chunk of change, right? It's a lot of information. Please watch this video several times. Come see me if you have any questions about it. The next chapter that we'll be going through is autonomic nervous system. I sort of laid a little bit of the groundwork for that, okay? And I appreciate you guys watching. Please let me know if you have any questions. I'd be happy to help. Thanks.